I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about advanced care planning. We don't talk about it often, but we should. Unfortunately, advanced directives, as we typically think of them, aren't working. Too many people reaching the end of their lives don't have an opportunity to make an informed choice about the medical care that they want to receive. The conventional wisdom is that advanced directives are the solution. But in reality, advanced directives often aren't available when they're needed, or they're misunderstood, or just not supported by family members. I know the limitations of advanced directives from personal experience. 6 years ago, when my mother was in her late 80s, before her Alzheimer's disease was too advanced, she completed an advanced directive and specified that she didn't want 911 to be called in any event. We made sure that both her nursing home and the local hospital had copies. We even tucked one in the pocket of her wheelchair. And my sister, who lived in the same small community, also kept one with her at all times. But when my mother developed pneumonia, the nursing home called 911, and the hospital promptly launched an all-out assault against the pneumonia, exactly as if no advanced directive existed. We finally worked with a compassionate physician who listened to us, read the advanced directive, and followed my mother's wishes. But it took a lot of family intervention to do what my mom wanted. One highly respected approach to planning for end-of-life care was developed by Gundersen Health System in La Crosse, Wisconsin. Gundersen realized that trying to plan for all possibilities in a single document is impossible and unnecessary. So they developed a 3-stage program that can be updated over a period of many years, which is easier than conventional advanced directives and makes sense to both patients and providers. The Gundersen Program Director, Dr. Bud Hammes, shared information about their experience at HFMA's Thought Leadership Retreat in October. He said that after implementing the program throughout La Crosse County, treatment decisions were found to be consistent with the patient's instructions more than 99% of the time. Also, family members reported less decision-making stress and lower rates of depression, and the total cost of care in the last 2 years of life was nearly 40% below the national average. As you may know, CMS is moving toward coverage for advanced care planning services for the first time. From my perspective, it's about time. When HFMA submitted comments to the proposed rule to CMS, we reiterated our strong support of coverage for advanced care planning services. We believe it is a key element of patient-centered care. In our value project work, we identified respect as a core element of quality from the patient's perspective. By having these crucial conversations and ensuring that we are abiding by what patients want, we are demonstrating respect for them at the time when it matters most. I've found that people are hesitant to talk about advanced care planning from a cost-saving standpoint. That's understandable. It's not easy to talk about these things. But there are 2 relevant points to consider. First, Medicare spends more than 25% of its budget on care in the last year of life. More importantly, we need to keep in mind that advanced care planning is driven by what the patient wants. When you look at it from that perspective, there's no reason to be afraid to talk openly and honestly about end-of-life care. As Gundersen Health System's experience demonstrates, everyone benefits when we do. Thanks for watching. I'll see you next month.